So when it comes to lip fillers and just sort of any augmentation when it comes to the face, one of the most common questions we get is, what exactly are lip fillers?
So what I would say is lip fillers are injectable treatments using hyaluronic acid based product. We use a range of different services and products in the clinic. So for example, we do use Juvederm, we also use Teoxane, and depending on the look that the patient wants to go for, we ascertain exactly how much filler we would administer. These are always administered by medical professionals. And we would say, for example, for myself, I wanted something subtle but hydrated and plump, so I went for 0.5 ml. Some people who want something more pronounced may go for up to 1 ml, but as a clinic, we don't offer anything above 1 ml in one sitting. We believe that you should allow it to settle, and if you feel you need any more, then we would address that at the time.
Definitely adding on to that. So, as you mentioned, we do offer a range of hyaluronic acid fillers. This is something that's obviously within the skin. It's very natural. There are other fillers on the market that are calcium-based. They're more permanent. The reason we don't choose to use these, they can last up to 2 to 5 years, but they aren't exactly reversible. So obviously you may be trying lip fillers, and one thing that we think is a benefit of having, lip filler treatment is that, you can try it out. Maybe if it's not the right look for you, it is reversible. We do have something to, reverse that and give you the natural lips back. However, if you were to go to maybe another clinic where they use something a little bit more permanent, you would possibly be stuck with that look, or you would have to surgically remove that. So that
Absolutely.
would be definitely something, and we've had quite a few horror stories in clinic that will probably be for a different podcast. But also going back onto what you said about how much we offer, we've had people coming in wanting 2 mil, 3 mil, loads in their lips. And adding on to that, the reason why we don't like to overfill the lips is the lips overall on the face is such a small part. If you overfill this area, the filler has nowhere to go. It will migrate. And I think that's what we're seeing a lot more of these days, these sort of kind of overfilled pillow face, like you have a shelf of filler above your lip. I don't know if you've seen it, Lauren. What is your thought of this?
There's a huge amount of migration within the industry, which is why it's so important to choose the correct injector, and also to not allow the customer to sway you as a professional. They may want more and more and more. And we see a lot of patients now who went for quite a lot of filler built up over time, coming to us, getting them dissolved and refilled because they want to go back to zero, see how their natural lips are looking, and then get a more natural, youthful, plump pout without being overfilled.
Yeah, I think that's definitely what we're all about at Hannah London. It's not about making you a different person. It's just, you're beautiful the way you are, but these little things can just be something